Hello, good people. It's been quite long, so I would like to continue. I was talking about infertility in male, female, issues about pregnancies, issues about family planning, but now I'll specifically today talk about infertility in male. This thing starts quite long, quite way back when someone is young until they grow, and the results will be seen when someone is really looking to get a baby. Now, for a start, male, anyone who has a boy, a young boy, consider the following. If you do a scan when you're pregnant, and in case the whoever was doing the scan is able to confirm that this is a male, they will always see testicles, two testicles in the scrotum. They are visible if the one doing is able to see. I'm saying because I know a number of those who do scans are not able to mention this or are not able to visualize this. But then again, it's not a bad thing if a scan is done and you are told it's a boy, but then you give birth to a boy. Now, when for ladies, those I know those mostly who keep birthing their babies, kindly check if the two testicles are in the scrotum. There are many cases of very mature teens and even old men who come to the hospital confirming that they've not had one of their scrotum or both are missing. So imagine this is a case of infertility. So what happens sometimes, the baby is born and the scrotal sac is empty, either having one testicle, and in this case infertility at the end of the time will occur. Now for this, if it's done early, suppose you notice this, I advise ladies who have babies to check on them every time they are bathing them, so that you confirm there are two testicles. Touch and hold the scrotum and confirm the two testicles are in, and this is a sure way of reducing instances of infertility when these people come of age. An instance of such, they can be rectified through a surgical operation, and the undescended testicle is taken back to the scrotum, the scrotal sac. This surely has affected a number of babies, a number of teens. I checked, and there was a patient I had. He was 26 years and he had not had a testicle. One of the testicles was missing, and if you do this, it might be late to be fertile, because also the testicle is not in the right position, so production of spermatozoa is hindered. Now that is one of the cases. In the earlier stages, again, mostly we need to see kids in Pampers. I'm not against the idea, but I'm advising that when you have your boys on Pampers, let them not be there for too long. These are the main reasons I would say this. Scrotum, the male reproductive system is late to hang. So if you keep your babies with Pampers for too long, you hinder air circulation, blood flow, and other things, and in the production, and we call it oogenesis of spermatozoa. Now this is another thing, like if you advise ladies, for those who use Pampers, diapers in this case, let it be a short time and when it's necessary. Keeping your boy child on pampers for too long might be killing, and I'm saying it might be killing the state of his fertility. You realize a number of male, especially the Muslim, they go for loose clothings. Imagine men do tight pants, underwears, and this is part of the hindrance into, and it leads to infertility. So for male, I advise too that if you have age, if you having tight panties, then it's a problem. It will be a problem, but this might not be known as per se. I advise male during the night as you sleep, you let your section, your reproductive organs stay freely. That is another thing. And one more thing that people cannot really understand is infertility comes on by a state we call testicular torsion. This case happens sometimes the male testicle is painful and you feel like it has some pulls towards and it's painful. It could be in case someone is hit or by a ball or anything, and this instance kills the male reproductive system, and at the end of the time it will be infertility as a cause in the end of the time. And this will now become a problem when someone is looking for babies and they cannot be able to make someone pregnant, in a simple term. So these issues are brought up are the ones that maybe someone cannot even think of that could be issues. Another thing is what you feed on. Most people don't really see this as an issue, but at the end of the time it will be an issue when you find that you are of age, married, and not able to sire. That is the best word I can use in this case. Sire kids for yourself. Let's see, I'll talk about food that can promote fertility in male. I'll talk about the drugs you might want to avoid. Over drinking alcohol is another thing. We will discuss this in consequent videos so that we get you enlightened. You know, it's the worst thing you can have in life is you're married, you want kids, your parents are expecting babies, but you are not able to sire, and sometimes it's traumatizing. But see, a number of these are self-induced, self-made. Like for example, those babies, if you cannot take action very, very early in life, you will be having a male who is not fertile. And this has happened. It has really happened in many cases. You find someone doesn't really know that they need to be having 2 testicles in their scrotum, and the feeding and the drinks that we do are another thing that hinders our production. And see the diapers on the temperatures, you see scrotum is supposed to hang out, so that that is the state, that is the optimal temperatures. Now that is in simple terms, optimal temperatures. Scrotum is supposed to hang, not tight. You can realize this on small babies who have diapers. When you remove the diapers, you'll always see the penis erect. It should be erect. It should be erecting all the time when it's necessary. For this and many other more videos, kindly subscribe, follow, ask me questions. I'll be engaging. I really want to help one another in this session. Thank you.